and it is the most common cancer among the worldwide population in developed nations, and it is the second most common cancer all over India or all over worldwide. Coming to risk factors, generally age is itself is a risk factor. Other than that, not breastfeeding is an important risk factors, and there are some hormonal risk factors like late age, marriage, not having children, not breastfeeding, and there's some component of hereditary risk factors are there, where 10 to 15% can have breast cancer secondary to the familial history. Okay. Other than that, smoking, alcohol are contributory risk factors for breast cancer. So, women commonly present with a lump or swelling which they notice. Maybe generally they say while taking bath, then they'll notice some abnormality in the breast. That is most common symptom. Other than that, there's a discharge from the nipple. It can be a whitish discharge, serous. Any form of discharge can be a sign of breast cancer. It can be blood also, and change in the color of the skin of the breast compared to opposite side, and increase in the size of the one breast compared to other breast, and any skin scarring, thickening, or puckering. These are the common symptoms in early stages. Late stages they might present with breathlessness, bone pains, and any generalized weakness, not able to eat. In very advanced cases. There is no exact data to support only self-examination of the breast will decrease the mortality or incidence of breast cancers. But as a rule, we advise women to do at least once a month self-examination, and it will definitely help us picking up the early diseases. And other than that, there is a certain criteria to examine we do have a mammography, screening mammography, that generally we do after the age of 40 to 45 years, and some people where there is history of familial breast cancer, in such patients we do in early also. For example, a woman had a breast cancer at the age of 30, we start at least 10 years before that age for their siblings or daughters, and so for familial this thing. Wherever that breast cancer is proven to be familial. Otherwise, it is generally 40 to 45 years. Every year, one mammography will be sufficient to detect early most of it. See, BRCA1 and 2 are as I told, will component around maybe 5 to 10% of the overall 5%, less than 5% of breast cancer cases. And the woman who is detected to have these mutations, there's a high chance, and most of them will have at some point in the lifetime to having a breast cancer, especially BRCA1. These people will have by age of at least 60-70 years, there's a high chance that they will be as diagnosed breast cancer. So one important thing is we need to check whether that mutation is there in the present risk population. If that is there, definitely there are options of oophorectomy is one thing, because breast cancer is dependent on the ovarian hormones. So if they can get remove both the ovaries, the chances of coming breast cancer will reduce by 50%. And other than is the bilateral mastectomy, where they remove both breasts. If you remove both breasts, the chances will come down by 80 to 90%. And if you remove both breast and ovaries together, the chance of risk will come down very less, maybe less than 10%. So especially those who have proven mutation of BRCA1 or 2, it is definitely advised to undergo some form of prevention strategy like oophorectomy or mastectomy, or at least regular screening of the breast for breast cancers.